Hello, I'm Dr. David Hornbrook for another episode from The View from the Other Side of the Bench. As most of you know, I'm a clinician as well as a clinical director of education here at Utah Valley Dental Lab. So I try to address topics from the clinical side, us, the dentist, and then also from the lab side, the ceramist. I'm here today with Phil Nebeker, who does the ceramics here at Utah Valley Dental Lab. He's one of the master ceramists. And we're going to talk a little bit about photography and tools as us on the side of the bench, the clinicians can use to maximize our aesthetic results, especially when we're matching existing teeth. Now, Phil, I know that matching a single central or adjacent natural teeth is probably one of the most difficult things you do, right?
Absolutely.
Okay. So photography, how important of a tool is that for you?
We gain most of our information from photographs. And the quality of the photographs, the doctors that send really good photos, it helps us tremendously. So.
Okay, good. And you can see he's got a 50-inch TV screen, so it's blown up multiple times. It's important to have a good camera. Definitely a single lens reflex. I am a Canon person. Some of you may be Nikon people. It's whatever you like to use. 100 millimeter macro lens, either a ring flash or a double point. I prefer as an educator to teach the ring flash because it's pretty much dummy proof. It's easy to get. Before and afters are exactly the same. The problem with a double ring flash or double point flash is that potentially you could have that point at a different angle from your pre-op to your post-op, which will give you different lighting. The purists will tell you the double point flash will give you more shadows and more depth, and I agree. But I think a ring flash is certainly adequate for most of the dentistry that we do, that you would do. So this is a Canon. This is actually a case that I'm doing with Phil. And you can see it's going to be a single central, tooth number 9. And so this is with a contraster. The black background is what we call a contraster. And it's just a black piece of plastic. And it just gives Phil a little bit more information about what's going on the incisal edge. Any feedback you can talk about that, Phil?
Yeah, these are awesome. For one, it gives us a lot of the characterization that a tooth has naturally. We can see where everything starts and stops, dimensions. It really gets into what we're looking for in color, line angles, the way the light refracts, and very, very useful tool.
So I took lateral pictures. Obviously, I wanted to show the nuances of the translucent edge, and what's interesting on this one is, just like I like with my veneers, you see that amber halo. And if we didn't have a good photo of this, he wouldn't be able to see that amber in the incisal edge, and then my single crown or my single veneer would not look like the rest of the teeth.
Yeah, they look very different in different light, different angles. The way the flash hits it changes the overall appearance a lot. We can see a lot of the craze lines and different characterizations with this angle that we can't see in the head-on angles. So
go back to that next one, Phil. One of the things we see with especially a ring flash is we see the shiny parts of the teeth, the reflective parts of the teeth. The flash rebounds and it kind of distorts surface texture and some subtleties. And so go a couple pictures further. I want to talk a little bit about a polarizing filter. Let's stay there for a minute first. It's very important when you have a tooth with multiple shades to take photos with the shade tabs as close to the same two-dimensional plane as the teeth you're trying to match versus on top of the tooth or too far behind it. Use as many shade tabs as you can that pull in shades from that tooth. Because you can see, keep going there a little bit, Phil, you can see we have different shades, so he can see the relationship between the shade tab and the teeth we're going to match. Now, as I mentioned earlier, you can see some shininess off the reflective surface, which hides some of the information that Phil will use for that final restoration. One tool that I found invaluable in my practice, especially matching existing teeth, is what we call a polarizer. Just like polarized sunglasses. You're looking across the ocean or the lake or the snow-covered mountain, and you see those shiny areas. You put polarizing lenses on your sunglasses, and it neutralizes everything and gives you actually a better sense of depth. So this, the one that I use, you can get it from PhotoMed, and it's called Polar Eyes. And it's available either for the Nikon or the Canon, and it's available either for the double point or the ring. And what it is it looks like this, and it's polarizing filters, and it comes with these little magnets that you attach to your ring flash, and it just snaps on there. So what I like to do, I like to take a photo, a regular photo, with the full ring flash, you can get the most amount of light with the shade tab, and then I'll put the photo eyes on there, and I will take another photo. So as you look at this photo, notice that we've muted all the reflective areas out. So he can see the depth, he can see surface characteristics, he can see especially hypocalcification, because it really almost exaggerates the hypocalcified areas that you don't see in other photographs. So what I did here is all the different shade tabs that are close to areas within the teeth we're trying to match, I took them with the regular ring flash and then with a polarized filter. So why don't we just leaf through those a little bit, Phil, and you can see those. So you can see, let's go back to that one. I don't know if you'll be able to see on this video, a lot of amber in that incisal edge that didn't show up with the previous non-polarized picture. So would you agree with me? The thing about ceramists, the thing that I've really come to appreciate is they're artists. So they're very, very visual. And you know, Phil, is the saying, a picture's worth 1,000 words. It's 10,000 probably when it comes
Absolutely.
to you. You know, as you look at this, and this 01 shade tab was the original one that I thought was about the correct value. As soon as I polarized it, whoa, you can see the value is completely off. And so we can leaf through this, or Phil can leaf through this, as he's looking at the different nuances and characteristics of the shades, and then he can look at the polarized filter.
One of the interesting factors here, when you have the flash, it captures the line angles, which is valuable too. But when you go to the polarized photos, it cancels that out, so we can actually see what's going on in the interproximal areas color-wise, where it's all washed out with the flash. So this is nice.
The other thing that I found really valuable, and I know that you shared this with me, is we get a crown back or a veneer and it's the wrong shape. We've all had that happen. That's why I think both Phil and I, he is the artist ceramist, and me as the clinician, one of the least favorite things that we used to do, I actually enjoy it now, is trying to match a single tooth. So we get that case back, that restoration back, we try it in, and it's a little bit off. Don't just send it back with another prescription. Photograph it. The polarizing filter, because of value, all of a sudden will just point that out almost immediately that we're at the wrong value. So lots of times the ceramists call that first crown, especially if you didn't communicate adequately the first time, they call it a custom shade tab. They look at it and say, oh, that's what they meant by that. But if it's polarized, it's even that much more powerful. Anything you want to add to that?
Yeah, this is a neat photo, because in this picture the shade tab actually looks warmer than the tooth. But when you jump to the polarized, you can see that it's actually a lot closer than what it looks like. So a lot of times we really trust the dentist in picking the shade tabs, and we'll get photos that don't necessarily match the tooth. So this is just another way that we can double check and make sure that we're kind of on the right path, having a polarizing lens. But
Awesome. Well, I can't wait to get this case back. It'll be interesting to see. Well, I appreciate you watching this. I hope it was valuable, and I hope the next time you do that single central that you say, wow, this is some information that made that much easier.